My name is Carol Klocek. I'm the Chief Executive Officer for Center for Transforming Lives. I got into this work kind of in a way accidentally. I knew that I always wanted to help people who were living in poverty and experienced a lot of difficulty in their lives because that's what I had been through. When I grew up, I was the oldest girl out of 8 kids, and we didn't have enough food, we didn't have enough room. I lived in a room without heat or air conditioning, and life was really tough. I was able to leave that because someone helped me. She was the one who told me about college and explained financial aid and gave me a path forward. So at Center for Transforming Lives, it's the best thing in the world because I get to bring all of that personal passion and energy into the work that I do. Plus, I've gotten my education along the way, thanks to Meg, who really made that possible. And I get to lead this organization that has an impact on so many lives. So, the Center for Transforming Lives is actually the oldest anti poverty organization in Tarrant County. We turned 115 years this year. So, amazing organization that's always been focused on women, and we've kind of evolved over time to really focus on women and their children. So, we are a multi-service organization that is always two generational in focus. So, meaning we're working with the mother and the child at the same time in all of our programs, helping them move from the state that they are in to really the state they want to be in. And our goal is around emotional and financial well being. The services that we offer include housing, early childhood education. We do clinical counseling for trauma intervention, and we also offer economic mobility services, a wide array of those, so that people can set and achieve their financial goals. So, the way that we help a woman prosper is we look at her individual circumstances, and we look to see where she's stuck. So, she may be a woman, say, with two small children who's working full time, but still living in a motel because she just doesn't have that amount that she needs to get into an apartment. So, we do problem solving with her. We look at what are the services that we can connect her with to reach her goals. So if her goal is security for herself and her children, then that may involve finding her subsidized childcare. It may be about getting her car repairs so she can drive herself to that better paying job. It may be about connecting her with our great community colleges or a certificate program to earn more money. But it's all about whatever situation that she's in, and identifying what that is, creating a plan with her, meeting her needs and her interests to help her to achieve over time. So, mental health has a tremendous effect over everything that we do. We know that research tells us that more than 90% of the women who experience homelessness have experienced trauma throughout their lifetimes. Um, Even the children who are in our housing programs, more than a third of them have high rates of trauma that we measure. So they've gone through a lot personally, to the children and the mothers. But we also know that the conditions of poverty and homelessness by themselves are ones that really foster conditions of depression and anxiety and other mental illness. So we are trauma informed in our work. So everything from the person who answers the phone to the case managers, the clinicians, every single one of us in the organization is trauma informed trained. And then we have specially trained therapists on staff who are able to provide that critical intervention at no cost, of course, to any of the participants when they need that how they need that, with the intensity that they need that, so that we can help them to heal while they're on their journey. One of the most common ways that people are seeking help from us these days is, of course, through our website, at transforminglives.org. They'll come through our doors. People walk through our doors all day long, every day, at one of our 14 different sites that we operate from in Tarrant County. But we also have a very strong referral network. We partner with more than 100 organizations in Tarrant County. So our partner organizations are our strongest referral partner, making sure that women with children get to the organization that does that work the most in a most focused way.